Welcome to the Diary of a Medicinal Chemist.
Discuss about distribution and the number of factors that also influence how well a drug is distributed in the body. And of course, that the body is more like a vessel, and that there are several compartments within the body that the drug has to traverse in getting to the target site. Again, this is dependent on the target that the drug is designed for. Now, moving on, we have metabolism. This is another very important process that happens within the human system. And what this simply means is the biotransformation of compounds into less toxic and more soluble entities, so to speak. So it is a very important aspect that is assessed. We need to understand the metabolic studies of our drug, or rather of our drug candidates before eventually it is administered, for a number of reasons. Because metabolism alone plays a very crucial role in bioavailability. Now, how do I mean? There are a number of drugs, when they are metabolized, there are a number of scenarios that can occur when a drug is metabolized. Is either you get a less toxic and a more effective agent, or it becomes more toxic and a less effective agent, or it doesn't even have any, it changes the activity. Maybe, for instance, a drug that has been envisaged to target a particular receptor, for instance, in a particular disease. Let's say that is designed as to be an anticonvulsant, for instance. After metabolism, you might be surprised that at the end, it can change that activity totally to a completely new activity. Could change the activity from the initial activity to, let's say, anti-diabetic. So there are so many things that we also have to take cognizance of in the metabolism stage. Now, what happens is, when you look at the human body, there are so many sites for metabolism, but one very important organ that is important for metabolism is the liver. So the liver is what I can describe as the customs office, or the customs agency, or even the immigration, because it controls what comes into the bloodstream. So it doesn't have any bias towards drugs, for instance. So whatever is coming into the bloodstream, be it food, drug, or what have you, the liver is going to carry out a number of processes on it. Now, in the liver, we have two major processes, two major biotransformations that drugs undergo in metabolism. The first one being the phase one. Now, we have a group of enzymes in the liver. They are called the cytochrome P450 enzyme. So the short form is CYP450. They are a large family of enzymes that are very important in the metabolism of drugs. So these enzymes are responsible for the metabolism of drugs. They act on drugs.